Hi, my name is Holly Hartley, and I'm going to be talking to you about a position statement from the National Athletic Trainers Association talking about exertional heat illnesses. Summer and fall are two of the busiest seasons for competitive sports and athletes. Sports such as football, cross country, and soccer are just a few that constantly practice in the extreme heat of the two seasons. Heat-related illnesses such as heat exhaustion and heat stroke can be a high risk for athletes practicing in extreme heat conditions. Certified athletic trainers evaluate and treat heat-related injuries during athletic activity in safe and high-risk environments. In order to undermine and take control of heat-related illnesses, proper precautions must be met on and off the field in order to ensure appropriate health management of the athlete. The treatment guidelines for heat-related injuries will provide athletic trainers with a practical approach to the prevention and treatment of heat illnesses. Athletes that begin training in the late summer will experience more exertional heat-related illnesses. The recommendations that will enable athletic trainers are as follows. 1. Identify and implement preventative strategies that can reduce heat-related illnesses in sports. 2. Characterize factors associated with the early detection of heat illnesses. 3. Provide on-site first aid and emergency management of an athlete with a heat illness. Determine appropriate return to play procedures. 5. Understand thermoregulation and physiologic responses to heat. 6. Recognize groups with special concerns related to heat exposure. Exertional heat illnesses can be grouped into many different categories. The main illnesses that present the biggest problems within sports teams include exercise-associated heat cramps, heat syncope, heat exhaustion, and heat stroke. Considering the type of environment the athlete is playing in, the athletic trainer must be aware at all times of what the temperature is and what medical needs are in hold of the athlete. In any type of practice or game, the athletic trainer should have a prevention plan at all times during heat-related sports. The prevention plan includes a medical screening, acclimatization, conditioning, environmental monitoring, and suitable practice adjustments. A medical screening before any practice or game is necessary to identify what athlete has been predisposed to heat illness or if any have had a history with heat illnesses or heat exhaustion. Athletes must prepare their body to the environment surrounding them, whether warm or cold. Acclimatization must occur between 10 to 14 days to increase the intensity and duration of work in the heat. A time increment between 1 to 2 hours each day under the same temperature will help to ensure consistency within the athlete's event. Hydrating throughout the practice will help the body through regulation of sodium and electrolyte levels. As a coach, he or she must be aware of the conditions at all times, making sure to schedule a practice an appropriate time of day to guarantee the athletes will not be practicing at one of the hottest times of the day. Scheduling a practice outside before 10 a.m. and 5 p.m. is best to avoid direct sun exposure. If there is a cool, shady area, recommending that the athletes run in the cooler climate can decrease the risk of heat-related illness. Football requires a large amount of gear and clothing in order to protect the body from injury. However, if it is a hot day, practice adjustments can be made in order to prevent heat illness. A full football uniform prevents sweat evaporation for more than 60% of the body. As much as protective gear should be in order, loose clothing is recommended and new generation cloth has been designed to allow for more effective cooling. Allowing a supply of water or sports drinks near the athletes will help with the rehydration between breaks and practice. Ice is good for keeping the beverages cold and having on hand when necessary for someone with beginning signs of heat stroke. The three main heat illnesses that are most common include heat cramps, heat exhaustion, and heat stroke. The recommended treatment within a clinical or a sports setting is as follows. For heat cramps, to relieve the cramp, the athlete must stop activity and begin replacing lost fluids with electrolyte and sodium-based fluids. Some stretching can be good to relieve the muscle cramping, as well as changing your position could allow adequate blood flow to a cramp or pained leg muscle. For heat exhaustion, Making sure to measure the body temperature rectally, which will give you the most accurate form of body temperature. If the temperature is elevated, you must remove all excess clothing to facilitate cooling. If you are inside and able to use a fan or ice towels, these may help cool the body temperature down and will help to feel better faster. The last is heat stroke. Taking a rectal temperature again is best to differentiate between exhaustion and heat stroke. Lowering the body core temperature as quick as possible is best by immersing the body into a pool of water, preferably between 35 and 59 degrees Fahrenheit. Heat-related illnesses can be prevented as long as the proper precautions are met. Athletic trainers and other allied health professionals must be able to differentiate between the 3 common heat-related illnesses in athletes. Increased awareness will help to eliminate the severity and allow for players to be practicing at their best potential.